Hello everyone, today we'll discuss another multiple choice question. Let's begin with the question. A newly diagnosed HIV positive lady, okay, with CD4 plus count of 35 per microliter presented with decreased visual acuity and floaters. On fundus examination, there were dense white areas of retinal necrosis with interspersed areas of retinal hemorrhages. So, which is the drug appropriate, okay, in this patient? Option number 1 acyclovir, 2 famciclovir, and option number 3 valganciclovir, and fourth one is called ribavirin. Okay, so in this case, the HIV positive woman with CD4 plus count of 35 per microliter with decreased visual acuity and floaters. On fundus examination, dense white areas of retinal hemorrhage with retinal necrosis is observed. So this is the classical case of cytomegalovirus retinitis. Okay, it is the one of the opportunistic infection occur in HIV positive patient with very low CD4 plus count. The mainstay of management for this case is HAART, highly active antiretroviral therapy. Okay, so among these four, we have to find out the proper drug for this case. The first drug acyclovir is an antiviral drug. It is mainly effective against herpes simplex virus, herpes zoster, and other type of infection, and it is not effective against CMV retinitis. Option number 2 famciclovir. It is also acyclovir analog. It is effective against herpes zoster, herpes simplex viral infection, and herpes simplex encephalitis, etc. And it is also shows some activity against hepatitis B infection. It is a less effective, but it is an alternative drug for lamivudine in the treatment of chronic hepatitis B infection. Okay, so this famciclovir is also not effective against CMV retinitis. And option number 4 ribavirin, it is mainly used to treat RSV infection, that is respiratory syncytial viral infection. It is not effective against CMV retinitis. The option number 3 called valganciclovir. Okay, it is a valyl group of valyl prodrug of ganciclovir. Okay, and it is rapidly converted into ganciclovir, and this undergoes intracellular phosphorylation and it is converted into ganciclovir triphosphate. Okay, this ganciclovir triphosphate, it competitively inhibits the attachment of deoxyguanosine to viral DNA polymerase, and finally viral DNA synthesis is affected. Okay, so here ganciclovir and valganciclovir. So valganciclovir is valyl group valyl prodrug of ganciclovir, but ganciclovir when you given it is orally, there is a poor absorption, so bioavailability is very less, and that's why we'll go for intravenous injection of ganciclovir. But valganciclovir we can give this drug orally, and bioavailability is about 60%, and this oral valganciclovir is highly effective as intravenous ganciclovir. So valganciclovir, it is the drug of choice nowadays to treat CMV retinitis. Okay, and this valganciclovir, it 8 to 10 times fold greater than the ganciclovir effect. Okay, so this valganciclovir we can give orally as the induction dose of 900 mg 2 times daily for 3 weeks, 21 days, and after that maintenance dose of about 900 mg daily for another 1 month, 4 weeks. That is the dose of valganciclovir. Okay, and the side effects of valganciclovir is similar to as ganciclovir. Okay, like neuropsychiatric disturbances, nausea, vomiting, etc. Same as ganciclovir. So here, valganciclovir is also used for long-term suppressive therapy of CMV retinitis as well as other type of CMV infection, that is cytomegalovirus infection. Okay, so answer here ganciclovir, that is valganciclovir. Option number 3, prodrug of ganciclovir. Okay, and if CD4 plus count less than 50 per microliter, we have to monitor, or there is a screening is required, okay, every 3 months for CMV retinitis detection. If CD4 plus count between 50 to 100 per microliter, okay, there is a screening is required once in 6 months. And if the CD4 plus count more than 100 per microliter, okay, we have to do the screening for CMV retinitis once in a year. Okay, so the answer for this patient appropriate drug for this condition is valganciclovir. Thank you all.